Hey, our Chaos Doctors. Today we're going to take a look at cystic fibrosis, a genetic condition that affects the lungs, digestive system, and more. Imagine your lungs filled with thick, sticky mucus, making it harder to breathe. For people with CF, this isn't just an occasional struggle, it's an everyday battle. So what causes cystic fibrosis? How does it affect the body? And what treatments are available? Stick around as we dive into the science, the symptoms, and the future of CF treatment. Let's get started. Cystic fibrosis is a life-threatening autosomal recessive genetic disorder that primarily affects the respiratory and digestive system. It is caused by mutations in the CFTR gene, which encodes a chloride channel essential for maintaining fluid balance in epithelial tissues. The dysfunction of CFTR leads to thick, sticky mucus buildup in multiple organs, causing progressive damage and severe complications. The major function of the CFTR protein in the sweat gland ducts is to reabsorb luminal chloride ions and augment sodium reabsorption through the epithelial sodium channel. Therefore, in the sweat ducts, loss of CFTR function leads to decreased reabsorption of sodium chloride and production of salty sweat. In contrast to sweat glands, CFTR in the respiratory and intestinal epithelium is one of the most important avenues for active luminal secretion of chloride. At these sites, CFTR mutations result in loss or reduction of chloride secretion into the lumen. Active luminal sodium absorption through epithelial sodium channels also is increased, and both of these ion changes increase passive water reabsorption from the lumen, lowering the water content of the surface fluid layer coating mucosal cells. Therefore, respiratory and intestinal complications in CF seem to stem from dehydration of surface fluid layer. CF primarily affects the lungs, pancreas, liver, intestines, and reproductive system. The hallmark of CF is chronic lung disease, driven by mucus obstruction in the airways, which traps bacteria and leads to recurrent infections, inflammation, and irreversible lung damage. Pathogens like Pseudomonas aeruginosa and Staphylococcus aureus frequently colonize CF lungs, further worsening respiratory function. Over time, bronchiectasis and respiratory failure develop, making lung transplantation a potential necessity in severe cases. Pancreas and digestive system. The exocrine pancreas is frequently affected due to mucus plugging of pancreatic ducts, which prevents digestive enzymes from reaching the intestines, leading to malabsorption, nutrient deficiencies, and poor weight gain. Patients require pancreatic enzyme replacement therapy to aid digestion. Liver and intestines. Mucus accumulation in the bile ducts can cause biliary cirrhosis and increase the risk of liver failure. Intestinal complications like meconium ileus are often an early sign of CF. Reproductive system. In males, congenital bilateral absence of the vas deferens results in infertility, while females may experience reduced fertility due to thickened cervical mucus. Cystic fibrosis is a monogenic disorder which can be classified on the basis of clinical course or the nature of the underlying defect. Mechanistically, they may result in reduced quantity of functional CFTR that reaches the cell surface or reduced function of CFTR that reaches the cell surface. They can also be classified as severe or mild, depending on the clinical phenotype. Severe mutations are associated with complete loss of CFTR protein function, whereas mild mutations allow some residual function. The most common severe CFTR mutation is a deletion of 3 nucleotides coding for phenylalanine at amino acid position 508. This causes misfolding and total loss of the CFTR. Worldwide, delta F508 mutation is found in approximately 70% of patients with CF. Since CF is an autosomal recessive disease, affected persons harbor mutations on both alleles. Although CF remains one of the best-known examples of the one gene, one disease axiom, there is increasing evidence that other genes modify the frequency and severity of organ-specific manifestations. Examples of modifier genes include mannose-binding lectin-2 and transforming growth factor beta-1. It is postulated that polymorphisms in these genes influence the ability of the lungs to tolerate infections with virulent microbe, thus modifying the natural history of CF. CF is one of the most common inherited diseases among Caucasians, with a prevalence of approximately 1 in 2,500 live births in populations of European descent. Carrier frequency is high, with about 1 in 25 individuals being asymptomatic carriers. Although it is rarer in other ethnic groups, cases have been reported worldwide. Thanks to newborn screening programs, early diagnosis has improved disease management, which significantly enhancing patients' quality of life and survival rates. One of the most noticeable symptoms is a persistent cough with thick mucus, often leading to frequent lung infections, such as bronchitis and pneumonia. Many CF patients also experience nasal polyps and chronic sinusitis, which can cause breathing difficulties. Beyond the respiratory system, CF significantly impacts digestion. Due to malabsorption, patients struggle with poor weight gain, even with a high-calorie diet. Additionally, fatty, foul-smelling stools are common due to the pancreas' inability to properly digest fats. Over time, chronic low oxygen levels can lead to clubbing of the fingers and toes, a telltale sign of long-term respiratory complications. Another unique symptom is salty-tasting skin, caused by high sweat chloride levels, a key indicator in CF diagnosis. CF can also affect growth and development, often leading to delayed puberty and, in many cases, infertility, particularly in males. Without proper management, CF leads to severe and life-threatening complications. In end-stage lung disease, progressive lung damage may require oxygen therapy or transplantation. CF-related diabetes results from a combination of insulin deficiency and resistance due to pancreatic dysfunction. Osteoporosis and fractures are also common, mainly due to chronic malnutrition and vitamin D deficiency. Biliary obstruction can lead to portal hypertension and liver disease, such as cirrhosis. Ultimately, respiratory failure remains the leading cause of death in CF patients. Thanks to advances in early diagnosis and therapy, the median survival age has significantly increased, now exceeding 40 years in many countries. CF treatment focuses on slowing disease progression, managing symptoms, and preventing complications. One of the most critical aspects of CF management is keeping the airways clear. Chest physiotherapy and airway clearance techniques help remove the thick mucus that builds up in the lungs. Additionally, mucolytic medications like Dornus alpha and hypertonic saline break down mucus, making it easier to breathe. To further improve lung function, inhaled bronchodilators and anti-inflammatory medications help reduce airway obstruction. Since lung infections are a major challenge in CF, inhaled antibiotics such as tobramycin and aztreonam are used to control chronic infections. Meanwhile, macrolides like azithromycin not only help fight bacteria, but also reduce airway inflammation, leading to better lung function. Recent advances have led to CFTR modulator therapies, which target the root cause of CF. Ivacaftor enhances the opening of CFTR channels, while the combination of lumacaftor and ivacaftor helps stabilize and improve CFTR function. These breakthroughs have transformed treatment options for many patients. Proper nutrition is essential for CF patients. Pancreatic enzyme replacement therapy ensures effective digestion and nutrient absorption. A high-calorie, high-fat diet along with vitamin supplementation helps prevent malnutrition and supports overall health. Looking ahead, exciting developments are on the horizon. Gene therapy and CRISPR-based gene editing offer the possibility of permanently correcting CFTR mutations. Additionally, stem cell therapy holds promise for regenerating damaged lung tissue, offering hope for a future where CF may one day be cured. If you enjoyed this video, hit that like button, drop a comment, and if you haven't already, subscribe so you don't miss any future content. Got any questions or video ideas? Let me know in the comments. Until next time, take care and see you soon.